Peri-implantitis is a challenging condition that affects the tissue surrounding dental implants. It involves inflammation and progressive bone loss, which can ultimately threaten the stability of the implant if not managed properly. Recognizing the signs and understanding the underlying causes are crucial first steps in effective treatment. In this video, we'll walk through the clinical approach to managing and maintaining dental implants affected by peri-implantitis, focusing on both immediate interventions and long-term care strategies. Let's begin by exploring the root causes and why a tailored management plan is essential for every patient. The first step in managing peri-implantitis is to address its etiology. This means identifying and correcting the factors that contribute to the disease. Common causes include excessive occlusal forces, which can be managed by adjusting the patient's bite, and issues with the prosthesis design, which may require modification. By targeting these underlying issues, clinicians can reduce ongoing damage and create a more favorable environment for healing. Addressing etiology sets the foundation for all subsequent therapies and helps prevent recurrence. Once the causes are addressed, anti-infective therapy becomes the next critical step. This involves thorough removal of plaque from the implant surfaces, which is essential to halt the progression of infection. Subgingival irrigation with 0.12% chlorhexidine is commonly used to disinfect the area, and systemic antimicrobials may be prescribed in more severe cases. The goal is to eliminate bacterial biofilm and create a clean environment that supports tissue healing. This phase is vital for controlling infection and preparing the site for further interventions if needed. When treating peri-implantitis, the choice of instruments is crucial. Conventional metal instruments can damage the implant surface, so clinicians should opt for plastic tools specifically designed for implants. In some cases, soft lasers may also be used to decontaminate the area without causing harm. This careful selection of tools helps preserve the integrity of the implant and surrounding tissues, ensuring that the treatment is both effective and minimally invasive. For advanced cases where non-surgical methods are insufficient, surgical intervention may be necessary. The primary goal of surgery is to treat bone defects and promote re-osseointegration, which is the reattachment of bone to the implant surface. This can involve various techniques, such as bone grafting or guided bone regeneration. Surgical treatment is tailored to the specific needs of each patient and aims to restore both function and stability to the affected implant. After intervention, ongoing monitoring is essential to ensure the long-term success of the implant. Patients should attend recall visits at least every 3 months, during which clinicians assess tissue health, plaque accumulation, and bone stability. Early detection of any issues allows for prompt management and helps prevent recurrence. This proactive approach is key to maintaining implant health over time. Cumulative interceptive supportive therapy, or CIST, is a structured approach to ongoing implant maintenance. It involves regular assessment of clinical parameters, such as suppuration, bleeding, and radiographic bone loss. By systematically monitoring these indicators, clinicians can detect infections early and intervene before significant damage occurs. CIST is a cornerstone of modern peri-implantitis management and supports long-term implant survival. Meticulous oral hygiene is vital for patients with dental implants, especially those who have experienced peri-implantitis. Soft bristled brushes should be used to clean around the implant without causing trauma. Minimally abrasive toothpaste, chlorhexidine rinses, and appropriate interproximal aids like floss or interdental brushes are recommended. These measures help control plaque and reduce the risk of reinfection, supporting the long-term health of both the implant and surrounding tissues. In summary, the management and maintenance of peri-implantitis require a comprehensive, multi-step approach. From addressing the underlying causes and implementing anti-infective therapies to careful instrument selection, surgical intervention, and ongoing monitoring, each step plays a crucial role. Adhering to strict oral hygiene protocols and regular professional care ensures the best possible outcomes for patients with dental implants. With diligence and a proactive strategy, long-term implant health and function can be preserved.